want answers?
I'm as mad as hell, and I'm not going to take this anymore.
You want answers?
You have offended my family.
I think I'm entitled. You want answers? I want the truth.
And you have offended the Shaolin Temple.
You can't handle the truth.
Surely you can't be serious.
I am serious. And don't call me Shirley.
Radical Rant.
All right, for today's Radical Rant, I want to talk a little bit more about a story we covered the other day on drug testing for welfare. I had delivered a story giving you the data from Florida, Utah, and Oklahoma. And the Utah data was quite interesting in that it showed the state had spent about $26,000 on pre-screening tests, these written tests, so they can get the probable cause. And then the drug tests themselves they issued on these people. And it turned out to be about $1,000 to catch per 12 people, right? $2,000 for each of them, right? Because they caught 12 people. 12 people failed the drug test. And it cost them about $26,000. And so a lot of media outlets reported on this, and a lot of commentators spoke about this, about how this is further evidence that this whole drug testing for welfare, punitive reaction against poor people is a failed policy. You know, it's grounded in this idea that we're going to stop taxpayer money from being wasted on drugs. We're going to help the poor people. You know, if they have to get jobs, they have to pass drug tests. So we're going to help them. We're going to do right for them by giving them some incentive not to take drugs by withholding their money from them, right? So this is the whole idea, but it just turns out that to pass constitutional muster, you first of all have to give these pre-screening tests that cost you money, and then you got to give these drug tests, and then you find so few poor people actually fail them. Well, it didn't take long for the proponents of these measures, which primarily are being driven by ALEC. Now, if you don't know what ALEC is, it's not Alec Baldwin. It's ALEC, the American Legislative Council, basically. And they lobby state legislators, and they put together bills, and basically they try to push a very pro-business agenda within the state legislatures. Right now, they have been pushing this whole drug testing for welfare thing, and in some extents, drug testing for unemployment. And so far, we've got 8 states that have passed this, and there are another, according to the National Conference on State Legislatures, another 29 states that are looking to pass some sort of drug testing for welfare bill, despite the fact that in every state we've shown so far, it costs the state more money to issue the tests than it would have cost to just give people the welfare in the first place. Well, this report that I saw in the Salt Lake Tribune today, actually it was published yesterday, updated a few hours ago, is the first I have seen where officials that support this kind of stuff are trying to basically make it basically making it a situation. I'm sorry, I had to check up on an email there from Utah. They're trying to make it a situation where these drug tests are shown to be cost effective. And so here is the headline coming out of the Salt Lake Tribune. Data is in. Drug screening of welfare applicants is a mixed bag. Well, first of all, data are in, but all right. A mixed bag, they say. A mixed bag. Despite the fact that in Florida, when they looked, they found a lower rate of people failing the drug tests that were in poverty than the general public. They found it cost far more than it was making. But it's a mixed bag, apparently. And here's how they get around to mixed bag. Data from Utah's first year of screening welfare applicants for drug and alcohol abuse revealed that the Department of Workforce Services spent over $30,000 on surveys and drug tests, but saved an estimated $369,000 in unpaid benefits because of the scores of applicants who walked away rather than submit to the scrutiny. Okay, let's follow the bouncing ball of prohibitionist logic on this one. Representative Brad Wilson, who's a Republican, surprise, of Kaysville, Utah, sponsored the bill last spring that makes this whole drug testing for welfare thing. And here's what the data show. From the Utah Department of Family Employment, the Family Employment Program, which is part of TANF, which is the, welfare. Let's just call it welfare. Agency data show that 1,020 of 4,730 applicants scored high on the screening, the substance abuse subtle screening inventory, written test that's supposed to ferret out people who might be more likely to use drugs, the so-called probable cause they need to, seize their urine. So 1,000 out of 4,700 scored high on this test. So, 20%, 23%, somewhere between 1 in 5, 1 in 4, aren't smart enough to figure out how to answer the questions on the quiz to not get, further screening. So of those 1,020, 466 were drug tested and 12 tested positive. Just 4 sought treatment. Now, the way this Utah law is written is that the people who test positive, or people that fail the screening, have to take the drug test. People that fail the drug test then have to go under treatment. They have to go into rehab. Okay, so 12 people tested positive. 8 of them said, screw that, I'm not going to rehab. And the whole goal of this, as the supposed goal of this, that the Republicans sponsor this stuff keep saying is, well, we're doing it for their own good. We want to help them out. If they've got a drug problem, my gosh, we want to help them out. 2/3 of them aren't helped out. Of the 12 you caught, 8 of them would rather not get welfare than go to rehab. So it's not helping them get any rehabilitation. And certainly when they're not getting welfare, I'm sure they're just sitting around, not earning money, not causing any problems to anyone whatsoever, as they're all poor and homeless. They wouldn't, resort to crime or anything. But here's how they want to try to spin this. So check this out. They did the total of the screening costs and the drug tests, and the total was $31,566.50. So, about $32,000, right? So, here's where they get their number. Here's where they get their amazing savings. Some 247 high-probability applicants failed to comply with requirements and were barred from reapplying for aid for 90 days, DWS Public Information Officer Nick Dunn said. Because the average 3-person household receives $498 per month in cash assistance, agency officials calculated that the total cost savings for the 247 turned-away applicants and their dependent children was $123,000 a month, or $369,000 for the 3-month period they were prohibited from reapplying. So because 247 people wouldn't take a drug test after the screening came through, they're counting that as $370,000 worth of savings of money they didn't pay to these guys who would have gotten welfare. Now, first of all, it's confusing me a little bit why not giving money to people who are demonstrably poor when the program is for that purpose. How saving money by not giving them that money is actually a success. It sounds to me like we would be cheering the money we would save not paying the fire department to put out fires in poor people's houses. It doesn't make a whole lot of sense. The money we would save in emergency rooms if we didn't treat the poor people that came into them. The purpose of a TANF program, a welfare program, is to give some people some bare minimum level of social safety net. And that helps us all. Just like putting out the fires at the poor person's house keeps your house from burning down. Just like treating the people in the emergency room keeps them from infecting you or being dead and, disabled on the streets to a greater extent than they are now. Just like those programs help you, even though they're helping poor people, giving the people the welfare, this bare minimum social safety net, prevents them from descending into even further desperation and chaos that would lead to further drug use, that would lead to further crime. Now, I called DWS Public Information Officer Nick Dunn today and emailed him, and that's why I was checking on his response, because I wanted to know that this data really doesn't make much sense unless we know how many people applied for welfare in the previous years. Did more people or fewer people apply? And did fewer people start to apply month by month as the word of drug testing spread? Nick was really, really eager to get me all that information, but he just emailed me back to say, saw you're a radio guy, not with a newspaper. When do you need the info? Interesting. Well, he says he'll get the data to me. I wonder if he Googled me and found out who I was. Wouldn't want to make his data look bad, would I? Hey, that's all the time we got here for today. Thanks for joining us. Tonight, we're live at the Cannabis Cafe at 8 p.m. Pacific Time. I'm Radical Russ. Until next time, take care of each other, tokers.
This is the Russ Belville Show. The Russ Belville Show is blogging and podcasting daily at radicalruss.com.
You take a seed, you plant it, you grow it, you dry it, you roll it, you smoke it. You take a seed, you plant it, you